Hello, everybody. We're back again, and I know everybody enjoyed hearing Dr. Offit, and now we have the absolute pleasure of welcoming Secretary Carey to our meeting. Dan Carey is a physician. He was appointed Secretary of Health and Human Resources by Governor Ralph Northam in January of 18. Before his appointment, he worked as a cardiologist and served as senior vice president and chief medical officer at Centra. Now, for all of us, it's fun to know that he is a graduate of UVA, where he got his medical degree, and Harvard Medical School, and he has a Master of Healthcare Management from Harvard as well. So, Dr. Carey has been a very fierce and um, prominent advocate of equity and, of course, the whole vaccine movement in Virginia. So, we're really excited to hear from him. And he has arranged things to talk to us today. So we're very pleased to have him. Dan, you want to take it away?
Dr. Moneymaker, thank you. And I appreciate everyone's patience. We had some technical glitches, but I appreciate the opportunity to speak to this group. Really, my goal is simply to say how very thankful I am for this group and all that you have meant for all Virginians. So again, you all are playing a critical role in keeping Virginia safe from disease. And thank you for all of you for being here today. And I want to just acknowledge all of the challenges that this community has overcome in the face of a global pandemic. Many of you are on the front lines, and thank you to your efforts around immunizations. And we are able to prevent the co-circulation of illness and protect our health systems from becoming overwhelmed, although that is being challenged in certain regions even today. And you ensured that the COVID-19 vaccine was accessible, whether it was by providing information or by providing the vaccine itself. You prevented lives from being lost. From the bottom of my heart, as a Virginian, as the Secretary of Health and Human Resources, I say again, thank you. Together, we have immunized over 5.7 million people in Virginia against COVID-19. And thanks to your efforts, thousands of children and teens receive their routine vaccinations to enter school, protecting our communities from vaccine preventable illnesses. For the majority of human history, children have been terribly vulnerable to a host of deadly diseases: diphtheria, whooping cough, tetanus, smallpox, to name a few. And these were diseases that put fear in every family's heart. The 20th century and now the 21st century have been the first centuries in human history where we can largely inoculate our children from these illnesses. It is such a testament to the power of science and medicine and inventing vaccines that we have largely eradicated these diseases in the U.S. And we have done that in part by requiring children to be immunized before entering school. And you all work to remind communities about this every day. As children start heading back to the classroom, we want them to be as healthy as they can be. We're over 18 months into the COVID pandemic, and last year in particular was a year like no other, especially the school year. Everything from doctor visits to school moved online, and we all lost our usual routines. But along with that, routine doctor and provider visits were disrupted for many children as well. For example, the Centers for Disease Control and Prevention data shows that measles vaccine ordering has dropped more than 20% since 2019. And that's just this one vaccine. Even for children who've been up to date on the required vaccines, a checkup is in order because 4 additional immunizations were added to the requirement list last month to better align with CDC recommendations. So we need to keep reminding Virginian families, take your child in for a checkup to keep them healthy and make sure they're up to date on their shots. And we wouldn't be here without the support and great work, heroic work of the Virginia Department of Health. Please use your networks to remind families that we provide free childhood vaccinations through the Virginia Vaccines for Children's program. Families can find providers through the VDH website and visit their local health department. I also want to emphasize that it's important to have a relationship with a trusted healthcare provider. Regular medical visits with a trusted provider means someone is keeping an eye on a child's growth and development, and then they can help keep a child healthy, do preventative care, and keep a child's immunizations on track. I also want to thank Pfizer for their support of the ImmunizeVA coalition. The Pfizer COVID vaccine is available for children 12 and up, as we all know, and the data looks very good for those between 5 and 11 as well. So we are hopeful in the weeks to come about that availability as well. Vaccines are safe, it's free. Let's continue the efforts to get our children vaccinated. And the Delta variant is more contagious, and we are all hearing tragic stories of children being hospitalized with COVID, and we don't want that for any child. So let's keep recommending wearing a mask in public. It's especially indoors, and it's a small step we can all take to keep our children safe and healthy. And I just want to also share that you all as caregivers, as vaccine program leadership, this has been an incredibly difficult time for all of us, leading amongst profound and prolonged uncertainty has a special toll on us. So take care of yourselves, take care of each other, and let's continue to share those values of truth, the value of science, equity, trustworthiness, and the power of communicating those consistently with perseverance to the public. And I know that truth in the end will win the day, and that's been threatened as we've seen during this pandemic. But with your communication about the safety and efficacy of vaccines and making them real for the families and children of Virginia is critically important. So please don't lose heart. I know that our efforts together will continue to be incredibly effective, but it also can be exhausting and frustrating. And we all need to buck each other up. I certainly know I've needed to be bucked up numerous times. And my colleagues, the governor, my colleagues in practice have continued to do that. And I know that you will continue to do that for each other. So thank you all so much for inviting me to be with you today. And I'm sorry for the glitch to have that a bit delayed, but it's been an honor to work alongside such esteemed colleagues who are truly making Virginia a safer, healthier, and more equitable Commonwealth. Thank you, and I'll turn it over to Dr. Offit. The floor is yours. Thanks so very much.
Rebecca, do we have any questions for Dr. Carey?
I think actually from here we were going to just move into a brief break. But thank you so much, Secretary Carey, for joining us today. And thank you for your words. I know that's a message that we all needed to hear as we have been working through the beginning of the school year and getting into flu season.
Well, pleasure to be with you all today. And I wish you all a great rest of the conference.
Thank you. Thank you for coming.
My pleasure. Thanks so much. Bye-bye now.
Bye.